Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. The Presidential Task Force on COVID-19 extends the phase 2 of the second phase of ease lockdown by 1 week as the task force retains existing safety guidelines. As the Minister of Labour and Employment meets the leadership of the Nigerian Association of Resident Doctors to avert an impending nationwide strike, resident doctors in Delta and Niger states embark on warning strike. As the SARS-CoV-2 virus continues to accelerate, the world has recorded over 16.2 million cases, while over 9 million people have recovered. Almost 650,000 people have been lost to the disease. In Africa is also seeing a rise in community transmission, with the continent recording over 845,000 cases. More than half of that number have been discharged, while the continent has lost over 17,000 people. Total confirmed cases in Nigeria passed the 40,000 mark after the Nigeria Center for Disease Control (NCDC) announced 555 new cases of COVID-19 infections. The cases were recorded in 17 states and the FCT, with Lagos, Kano, Ogun, Plateau and Oyo states recording over 50 each of the new cases in the last 24 hours. 2 deaths were, however, recorded last night in Cross River State. Till date, 40,532 cases have been confirmed, 17,374 cases have been discharged, and 858 deaths have been recorded in 36 states and the Federal Capital Territory. Secondary schools will now be reopened from August 4th, 2020 for exit classes alone as they prepare to write the West African examinations WAEC, due to start on the 17th of August 2020. The Federal Ministry of Education made the announcement today, explaining that the decision to reopen schools was reached at the end of a virtual meeting by officials of the ministry, the Commissioners of Education of the 36 states, the Nigerian Union of Teachers and Proprietors of Private Schools. It further says the Ministry of Education will meet with chief executives of examination bodies like NECO, NAPTEN and MBAIS to harmonize their examination dates. The meeting also resolved that a passionate appeal be made to the federal government through the Presidential Task Force on COVID-19 and the public for assistance to schools across the country to enable preparations for a safe reopening. At a meeting between the federal government, represented by the Minister of Labour and Employment, Dr. Chris Ngige, and the leadership of the Nigerian Association of Resident Doctors, NARD, is on the way in the nation's capital, Abuja. The conciliation meeting is aimed at averting another industrial action by the resident doctors who have threatened to resume the action following failure to address issues around welfare, the residency training program, poor state of infrastructure in government hospitals. The group had suspended an earlier strike following the intervention of the Nigerian Governors Forum and other government bodies. The doctors say that most of the demands that led to the declaration of strike 4 weeks ago have not been addressed by government. And rising from their meeting on Saturday, the association gave the federal government another 3 weeks ultimatum to address the demands or risk suspension of their services. Over in Delta State, the resident doctors at the Federal Medical Center, Asaba, joined their colleagues at the Nigerian Medical Association and other tertiary health institutions on a 3-day warning strike beginning from today. The doctors are appealing to the Delta State government to pay COVID-19 hazard inducement allowances to doctors on the front lines in the fight against the virus. They're also unhappy that the state is unable to provide adequate resources for medical personnel. Delta State has recorded 1,464 confirmed cases, of which 790 are currently on admission.
The payment of COVID-19 hazard inducement allowance for the month of April and May, which was commenced in the Federal Teaching in the Federal Tertiary Health Institution has been suspended abruptly. Immediately, NARD suspended her last strike action. Painfully, against the backdrop of assurances given by the Nigerian Governors Forum on the speedy implementation of COVID-19 hazard inducement allowance and tax rebates for our colleagues in the state's employment. Most states, including ours, are yet to do the needful. To this end, we throw our full weight in solidarity with the Delta State NMA as she has called out all her doctors on a 3-day warning strike, effective Monday, 27th July 2020.
The Presidential Task Force on COVID-19 is, of course, briefing today. You can also listen via our website, channelstv.com, and it indeed announced the extension of the second phase of the East lockdown by 1 week. The Secretary to the Government of the Federation, during his brief, Mr. Boss Mustafa, explained that the extension is necessary in containing the spread ahead of the Eid al-Kabir celebration. Mr. Mustafa also hints that the task force is working hard to fast-track the resumption of international flights.
The Presidential Task Force has continued to evaluate the developments as well as the level of compliance nationwide and has regrettably come to the inevitable conclusion that majority of Nigerians, irrespective of status, creed, and level of education, continue to live in denial on the virulent nature of the virus and consistently breach the guidelines and non-pharmaceutical measures put in place. It has also considered that due to the upcoming Salah, Eid al-Kabir festivities, which coincides with the expiration of the current phase, it will be prudent to extend by 1 week from 29th July till Thursday, 6th August 2020. It has accordingly secured permission to retain the existing guidelines till that date. Considering the importance of international air travel to the economy, the Presidential Task Force and the aviation sector are working hard to fast-track reopening of the international airspace. Most importantly, the arrival protocols for passengers on inbound flights are being firmed up for seamless testing and detection. Relevant MDAs will be holding further consultations.
For the Minister of Health, Dr. Osage Hanire, the ministry will continue to strive to improve on the quality healthcare and expand treatment capacity. He admits that the country needs to improve on testing and also activate more isolation centers.
When the epidemic curve will begin to flatten is still a matter of conjecture, given the relatively small fraction of our population that has so far been tested. It is our plan and our endeavor that our health system be not challenged beyond what it can bear. 60 PCR public health laboratories are now active in Nigeria and together should be in a position to address the testing capacity challenges and ramp up utilization if the logistics are able to get proper improvement. It is our desire to reduce fatality rates, as I've said, expand treatment capacities such that our health system cannot get overwhelmed. In this regard, the Federal Ministry of Health expects to take delivery of a newly completed isolation center at University of Abuja Teaching Hospital, Gwagwalada, very soon, just as other centers are under construction nationwide. So we're expanding our bed spaces and our capacity to admit in expectation, as we have always said, being able to prepare for the worst and strive for the best.
Dr. Jagu Akolo, the Registrar, Community Medicine Department, University of Abuja Teaching Hospital, who joins us from Abuja studio. Thank you for joining us on the program. I'd like to begin by asking, how difficult is it getting out of the community transmission phase of COVID-19?
Thank you very much for having me here. It's a pleasure. Well, first of all, I would like to educate us on what a community transmission entails. Because most of the time we hear community transmission, but we hardly fully understand what it means. Now, if you check the NCDC record, as at last week, Saturday, the number of cases that tested positive through travel is 2%. And then those that contacted the COVID-19 via contact with a confirmed case is daily about 23%. And we have about 73% of the population of the confirmed cases of COVID-19 with an unknown source of infection. That is to say that they could not actually trace where precisely, they contracted this virus. Now, this is where community transmission comes in. Community transmission comes in when individuals are infected and they barely can't actually trace exactly where the source of the infection is. So the data we have actually proves that we are actually in a community transmission phase. And it is actually a difficult one because we need to actually make risk communication and engage the community if we actually want to bring down these figures on the downward trend. What I'm trying to say is that we need to mobilize the community. We need to have access into this community. In fact, now we are talking about physical distancing. But I think since we are in a community transmission phase, we should be talking about a community-wide physical distancing. Why it is very key in this perspective is because since this thing is happening in the community, you need to penetrate the community. You need to meet the stakeholders in the community. You need to discuss with them about risk communication. And then beside that, you need to engage them on the discussion so that they will actually take responsibility of their health. Most importantly, this should actually be a down-to-upward approach. It shouldn't be a directive from up downward. But if community take responsibility and they adhere to all the rules, the non-pharmacological public health measures that we have been mentioning, then we are on the right track to curb or to reduce or to bring community transmission to the barest minimum. So the community need to be engaged. The community need to know exactly what COVID-19 is. They need to know the known, and they need to know what is unknown because it's a new disease. So they need to know what plans is on ground and also what intervention the authorities are doing in order to curb or to reduce the spread of this disease. Another important thing that I think is lacking, if care is not taken, there will be even such of the spread of the COVID-19. Because I expect that most of the state governors will continue, and the state chairman will continue to dialogue with the clergymen, with those people who owns, let's say, bar or restaurants. You need to engage them on a frequent discussion. Otherwise, this may just come as an information, and implementing the real non-pharmacological public health measures becomes an issue. Such as wearing of face masks,
as well.
Ensure that, yes, exactly. So it
Thank
is
you so
very
much,
key
Dr.
on that
Akolo.
regard. If you only pass information and you don't follow up to ensure that this information are strictly adhered to, then you will discover that we will not actually
there won't be any impact. We appreciate your time. Thank you so much, Dr. Jago Akolo, Registrar, Community Medicine Department, University of Abuja Teaching Hospital. Thank you for joining us. We have more on the COVID-19 updates when we return. Stay with us. We take you to Niger State, where the government is adopting new measures to curb the further spread of the disease. This is even as the organized labor in the state observes the second day of warning strike. Here's our correspondent, Emperor Simon, with more.
Niger State, as at the time of filing this report, has a total of 166 confirmed positive cases of COVID-19, with 8 deaths so far recorded. The state government is concerned about the rising cases of COVID-19 in the state and has taken new measures to curb further spread. One of such measures is that tricyclists can no longer take more than 2 passengers in their tricycle, while motorcyclists can only take 1 passenger at a time, and observing the necessary protocols such as wearing a face mask. The government has also said that the Eid al-Kabir celebration this year will be celebrated on a low key, and people will no longer have the liberty of observing the usual fanfare that comes with the celebration. It also says that the Eid prayer this year would be observed following strict protocol that has been laid out, such as washing of hands and the use of sanitizer as well as face masks. But that's not the disturbing situation in the state alone. One of such is that the organized labor has gone on strike, a warning strike since on Friday. Now behind me are members of the organized labor who have turned out to secure the gate at the Niger State Secretariat here in Mina. They are not allowing people to go inside. We spoke with the chairman of the Niger Medical Association in the state, and he told us via telephone conversation that NMA is not an affiliate of NLC here in the state, and as such has not embarking on the strike, but that other health workers such as nurses, midwives, and lab scientists are joining the strike. This is a very critical moment for the state government as it continues to battle with the issue of COVID-19. That's the update from Niger State. Emperor Simon for COVID-19 updates.
Let's find out what's happening in Bauchi State. Here's our correspondent, Hazra Aliyu.
I am in one of the private schools in Bauchi State, Dolphin Maria College, to ascertain firsthand the level of preparedness equal to the directive issued by the Federal Ministry of Education for exit classes to reopen on the 4th of August. Barrister Muhammad Al-Hassan is the proprietor of the school. Barrister, what arrangements have you put in place to ensure that these students are safe when they return?
Okay, thank you. First of all, we are very happy and excited at the prospect of coming back to school on the 4th, okay? Second of all, regarding the preparations, we have been working very hard to make sure, because we have seen earlier the protocols, released by the federal government. We have been working very hard to make sure we have everything in place. I am sure, like we have discussed this morning in our local chapters meeting of the Association of Private School Owners, that everybody is given the protocol to go back and make sure that we don't give chance to any element to abort the prospect of coming back. As you know, a lot of schools are almost bankrupt because of this COVID-19 situation. But it is possible that many schools will be able to look at these conditions and try to meet the requirements.
So students should be rest assured that their safety is guaranteed anytime they choose to return.
Of course, and we have to also have a regime for inspection to make sure that everybody tries and meets these conditions. So I'm sure people will work very hard to meet the conditions. I'm very sure of that.
Thank you very much. Yeah, that's the update from Bauchi. Hajara Aliu for COVID-19 update.
The UK has become the 9th country to pass the 300,000 confirmed cases mark for the coronavirus. The United States, Brazil, India, Russia, South Africa, Peru, Mexico and Chile have all had more confirmed cases of COVID-19. Here's the Global Update report.
News of the increase in number of cases in the UK came this afternoon. The total number of deaths also rose by 7 to 45,759 from 45,752 on Sunday. Meanwhile, a pet cat has tested positive for the new coronavirus that causes COVID-19 and the first confirmed case on an animal being infected with the virus in Britain.
Ens trobem davant dels, probablement,
Over in Spain, leader of the northeastern region of Catalonia has called on young Catalans to stop partying to help halt a surge in new COVID-19 cases, or local authorities may have to reimpose harsh restrictions. The Spanish government says young people are among the groups with the highest number of new infections in the post-lockdown wave of COVID-19. In Pakistan, Prime Minister Imran Khan says his government has succeeded in bringing the spread of COVID-19 cases under control in the country and has called people to consolidate these gains by following safety rules during the upcoming festival of Eid. The U.S. National Security Advisor to President Donald Trump, Robert O'Brien, has tested positive for coronavirus, but the White House says there is no risk or exposure to President Trump or Vice President Mike Pence. Finally, in India, actress Aishwarya Rai Bachchan and her 8-year-old daughter Aradhya have recovered from COVID-19 and left hospital after a 10-day stay. Her husband, Abhishek Bachchan, and his father, renowned actor Amitabh Bachchan, are still recovering from the disease and remain in a Mumbai hospital.
Remember the safety measures to keep the coronavirus away. Our website, channelstv.com, has the latest update on the pandemic. You can see the update from the federal government, of course, the secretary to the government of the Federation there on the extension of the phase 2 ease down by a week and several other updates as well on the pandemic. It's all on our website, channelstv.com. That's the program. Thank you for watching. I'm Millicent Nwaka. Stay safe.